name is Terry Tshadburn. I am a student at Gardner-Webb University. I'm working towards my BSM, and this is a community teaching project that I have worked out with the staff here and the volunteers at St. Luke's Free Medical Clinic in Spartanburg, South Carolina. I started volunteering here at the beginning of the semester and have really enjoyed that. And I've seen a large variety of needs that come through that front door. And in talking to Carol Clark, the clinical manager here, we had discussed several several issues that arise. But the biggest need here at St. Luke's Clinic at this time of year, other than I guess the flu and cold season, was osteoarthritis. Carol says that there's a lot of patients that come through with a lot of aches and pains, and that they don't have the general education to help care for these aches and pains that they need. So she's asked me to do my community teaching project on osteoarthritis. I've presented a little pamphlet for you to give out on this night. This is the night that the orthopedist volunteers, and I know that most of you are here to see the orthopedist for various things. I've helped check some of you in, and I know that there's some shoulder pain and some knee pain and some back pain and different types of pain issues. With these types of issues and pain, surgery and medication are not always the answer. Surgery is hard on the body. Oftentimes it's just a temporary fix, if it fixes it, at all. And pain medication, that's not the answer either. Pain medication just simply dulls the pain, dulls the receptors, and after that pain medication wears off, you still have the problem. So what I'm going to go over with you tonight is some management and prevention of osteoarthritis. And it's just very general information, but it's a place to start. And of course, as you see the orthopedist, you can ask him about anything that we've discussed here today and get his opinion on some of the topics and suggestions that I've given you. But each of you have a pamphlet excuse me, that I have made, and it's called Managing Osteoarthritis with Healthy Living. So if you'll just take a look at that, it's just a, like I said, very general suggestions on this topic, but I'm going to go through each one of them with you. So if you'll please open up your brochure and look on the first section. We talk about what is osteoarthritis. It is the most common form of arthritis, and it affects approximately 27 million adults. The cause is relatively unknown. It occurs when the cartilage in joints breaks down over a period of time, and you may hear this as, wear and tear, my joints are giving out, just different things, but that's where the cartilage breaks down over the time. It's usually found in joints that we use a lot, use and abuse a lot, such as our knees, our hips, our hands, and our spine. Any joint can be affected, but these joints are the main ones that we point out today. 1 in 2 people will experience some form of osteoarthritis in their lifetime. And if you're the one that doesn't, that's great. But for those who do, it's prevalent in women, and it accounts for 50% of the cases in the 27 million. So 50% of those 27 million are women, and 46 are adults. I've put a little picture here of a cartilage, a knee cartilage, and it just shows you that this is the healthy joint. And then this is the one that's been diagnosed with osteoarthritis. And as you see, the crepitation and the wear and tear here on the cartilage that's sort of just a good idea of how it would look if you could see into it. And you could see where that would cause some inflammation, some edema, and some pain. Some of the symptoms, and I'm sure y'all can tell me this better than I can tell you, is the pain in the joint, stiffness in the joint, flexibility, decreased flexibility or range of motion in that joint. It's painful. I got a wrist here that's has some arthritis in it. I hope that's all it is. And it causes some inflammation and some discomfort to me. You also might notice a little bit of what they call crepitus. Now, crepitus I can describe it more as a feeling but it's like a kind of a crackling and a popping when you move those joints, sort of crepitus. And it says when you notice some of these feelings or sounds, you'll notice them with everyday activities like climbing the stairs and getting in or out of bed or going shopping. If you have any of this, you'll need to talk to your physician about it. The risk to getting osteoarthritis increases throughout your aging process. So as you get older, the more prevalent you are to getting the osteoarthritis. Some of the other risk factors, other than just age, is someone in your family who has osteoarthritis, overweight, repetitively overuse of that joint, like bending, different things like that. A previously injured joint, such as a fracture of an ankle, a wrist, a hip, anything like that increases the risk for osteoarthritis. The treatment for the osteoarthritis is what I want to talk to you mostly about today. There's no reverse to the cartilage loss. There's nothing we can do about that. But there's ways to treat the pain. There's healthy ways to treat the pain. You may be able to manage it with an integrated treatment approach that includes a positive lifestyle and some anti-inflammatory drugs, like NSAIDs, that's non-steroidal anti-inflammatory drugs like ibuprofen, Aleve, Motrin. The thing with those drugs is you want to check with your physician and make sure that you're able to take those drugs, because like most medications, they're hard on your system and they can affect, if you have ulcers, they can cause an ulcer, bleeding ulcers, what a lot of folks call them. So you want to check with your physician before you start taking any type of medications to treat your osteoarthritis. Weight loss can make a huge difference, especially in your knee and hip pain. Every pound you lose, for every single 1 pound you lose, you can lose 4 pounds of stress on that joint. That's remarkable. 4 pounds. So losing a pound relieves 4 pounds on your knees. Just think about that. Just think if you lost 2 pounds, 8 pounds. That would be just a significant difference, and I'm sure you would feel it in your joints. If you follow a balanced diet and exercise regularly. Now, I know you're thinking, exercise, I'm already hurting enough without exercising, but you can start out with just low impact exercising, just walking slow, and you can build up to whatever your body is tolerable to. And in the meantime, while you're exercising and having a healthy diet, you're also having some weight loss, I hope, and that's improving your joint pain. Staying active keeps your joints flexible, it reduces the pain, and it improves your ability to move. You just would not believe how it improves your ability to move. Low impact activities is what we just discussed: swimming, water aerobics, water exercise. These water exercises put less stress on your joints. Stretching exercises, strength training, and aerobic exercise may help to ease the pain. Again, you want to start this off very slowly and build up to your tolerant level. You should discuss any change in your diet, exercise, or med regime with your physician or your nurse practitioner before you start any of this. On the back, I have put some resources down for you several resources, if you'll look on the back. And these resources are here locally. They're in Spartanburg County, the ministries of Spartanburg County, and I've put the address, and I've put what they can help you with. The ministries of Spartanburg County, the organization assists with serving nutritious meals for families throughout the Spartanburg County area. So if for some reason you're having a difficult time getting a nutritious meal, then call the ministries of Spartanburg and see if they can help you with that. Good for you, Spartanburg. This is a website that actually gives you choices for a healthy lifestyle. So if you're unsure of what to eat and how to change your diet to be a healthier diet for you, this is online, and I know the local libraries have web access, and there's no charge to use it. So if you'll go to your local library, there will be people in there to assist you. Take this brochure with you, and they can help you pull up these websites so you can find a healthy food choices for you and your family. We have here in Spartanburg the Black Rail Trail that's sponsored by Mary Black Hospital System. It's a walking and cycling trail. It goes right through downtown Spartanburg. There's bikes there that you can rent, but if you walk, the exercise will be just as good for you. It's at Henry and Union Streets. People walk, bike, jog, and they even use skating there for exercise. There's events throughout the year and on the trail. And again, I've put the website in here so that you can, if you don't have access to the internet, then you can go to the library and ask for some assistance, and they'll help you. The Regenesis Community Health Center. It's on Church Street in Spartanburg. This is a federally supported community health-based health center providing physicals, health sessions, counseling, and lab services. So if you find that you need any other medical services that can't be provided here through the St. Luke's Free Clinic, then you may want to check into Regenesis. In the Woodruff, there's a free medical clinic in Woodruff called Woodruff Free Medical Clinic. And it provides primary care, pharmacy, and specialist referrals. There is some eligibility requirements that I've included in the brochure, and there is a phone number that you can call. The clinic's open from 5 p.m. to 9 p.m. at night. So if you have any questions, I've given you the addresses, the websites, the phone numbers, the locations, and the times of all these resources. If you have any questions after this community teaching project, I'll be glad to, I'll be available for your questions and to help you get the questions answered and help you find the resources that you need for your situation. On the back here, I've put some more resources. And again, if you'll go to the library, the Spartanburg Library, and we have several branches throughout Spartanburg County. If you'll go to the library, ask them to help you with the internet, the web access, and to look up these resources. They'll be beneficial to you in your healthy living and your treatment of your osteoarthritis. So I hope you find this brochure useful. Keep it handy. Any questions you have, just call these places. And I thank you for your time and your attention. Thank you very much.